All right, we're now talking about our section 9 for chapter 13 on the brain and cranial nerves with the cranial nerves, our final section for the chapter. We're going to talk about 12 pairs of cranial nerves. It's part of the peripheral nervous system. They originate from the brain. They're numbered with Roman numerals that are according to their position. They begin with the most anteriorly located nerve, and the name of the nerve is often related to its function. So the cranial nerves start with the olfactory bulb termination of the olfactory nerve, which is CN1. See here in the actual microscopic image versus a diagram here for us. The olfactory tract leads down here to the optic chiasm. And then we have the optic nerve, which is CN2, located here and also shown here. The infundibulum, which is here, infundibulum, excuse me, is here, also shown here. Then we have the optic tract leading down, and oculomotor nerve, which is CN3, here and here. The trochlear nerve, CN4. Trigeminal nerve, CN5. Abducens nerve, CN6. The facial nerve, CN7. The vestibulocochlear nerve, the CN8. Glossopharyngeal nerve, CN9. The vagus nerve, CN10. Move it up a little bit here. The accessory nerve, CN11. And the hypoglossal nerve, CN12. The medulla oblongata there. And the spinal cord, of course, leading down below here. Those nerves you need to know, and there are numerous mnemonics. Rather than giving you one, I think you can literally Google mnemonics for cranial nerves, let alone numerous other aspects to the brain and the cranial nerves that we've talked about thus far that I would highly recommend you look up, and so you find the one you like, because there are numerous ones for each of these. So you probably find the one that suits you the most and you can remember the easiest, so it's easy to remember them, because you will need to know all 12 of these cranial nerves, let alone their location. Now the sensory nerve for olfaction and smell is an olfactory nerve, CN1. The axons, the olfactory nerve, are shown here. There's a cribriform plate here. The olfactory, let's get a little closer here. The axons here, the cribriform plate of the ethmoid bone here. There's the olfactory bulb, the olfactory tract, and of course that's all the nerves are emanating there from that bulb. For vision, CN2 optic nerve. We have the eye, and the optic nerve here, of course leading right to the eye. And we have the optic chiasm here, optic tract, and then leads up here to the optic nerve, CN2. And of course the optic projection axons are coming here for the visual cortex and occipital bone here, leading up to that optic tract, to the optic chiasm, and the optic nerve to the eye. We shouldn't forget the lateral geniculate nucleus of the thalamus here as well. And then the motor nerve that innervates the four extrinsic eye muscles, an upper eyelid muscle and intrinsic eye muscles, basically controls the muscles that move the eye, lift the eyelid, change the pupil diameter, change the lens shape. It's oculomotor nerve, CN3. And we basically have going backward kind of from the eye, the ciliary muscles here. This guy here is the optic nerve here, our CN1. Of course, our ciliary ganglion here. And we have our superior rectus muscle here, muscle for the eye. And of course, this here is leading to the sphincter pupillae. And then basically we have the oculomotor nerve here, innervating from there, CN3. And of course, the inferior rectus muscle here, another eye muscle, inferior oblique, numerous muscles there for control of the eye as well. And that oculomotor nerve is innervating all of them. CN4, a trochlear nerve. It's a motor nerve that controls the superior oblique eye muscle. And so we have that trochlear nerve here coming through. There's the optic nerve here, the big one here, superior oblique muscle. That's where the optic trochlear nerve is going to be innervating right there with the trochlea. And the CN5, the trigeminal nerve, is a mixed nerve that receives a somatic sensation from the face, controls muscles involved in chewing. So we have basically our trigeminal nerve here, CN5, and we have our trigeminal ganglion, the ophthalmic branch, which is V1, okay? The maxillary branch, V2 here, superior alveolar nerves, these guys leading out here to muscles here, leading here as well for mastication, for chewing. Here's our lingual nerve, submandibular ganglion here, mental nerve here. So you can see all these, which will come up a little bit here. The inferior alveolar nerve, more at later units, some of these, to the mylohyoid muscle here, the chorda tympani from the facial nerve here, the mandibular branch. But here's the trigeminal nerve, of course, it goes leading out here for all of those. And then the abducens nerve is a motor nerve that controls the lateral rectus muscle that abducts the eye. It's got a large number of these are for the eye. So we have our CN6 here, and it's innervating there, that lateral rectus, okay, playing a role with it, and of course showing the optic nerve as well here. Then we have CN7, which is a facial nerve. That's a mixed nerve that controls muscles the facial expression and connects taste sensations from the tongue. So we have our facial nerve here, CN7, right here, and there's our geniculate ganglion. There's the pons, and of course we're leading to the greater petrosal nerve here, out to the pterygoappeline ganglion, and then we have the lacrimal gland, our temporal branch here. There's our zygomatic branch. There's our chorda tympani nerve, which is traveling the mandibular branch of the CN5. We have our buccal branch leading out here, emanating out, submandibular ganglion, the mandibular branch. And then we have the branch of the lingual nerve of the CN5 coming out from here, coming all the way from up here. Our cervical branch having led from all the way here. And the posterior auricular branch leading out here, the stylomastoid foramen and the parotid gland. Our CN8 is a vestibulocochlear nerve. It's a sensory nerve involved in hearing and equilibrium. And so we have our vestibulocochlear nerve, CN8 here, from our pons there. And then the internal acoustic meatus. There's our cochlear branch and the vestibular branch, branching out to our semicircular canals, the tympanic cavity of the middle ear, tympanic membrane, the eardrum, of course the cochlea playing, or not playing a role, but being right here, innervating that cochlea for hearing and equilibrium. Then we have our CN9, our glossopharyngeal nerve. It's a mixed nerve that receives taste and touch from the tongue. It's the motor control of a pharynx muscle. So here we have our glossopharyngeal nerve, our CN9, and leading with that the inferior ganglion, going out to the parotid gland here, the otic ganglion, superior ganglion. Here we're going out to stylopharyngeus muscle, to the carotid body and the carotid sinus. And this is out to the posterior 1/3 of the tongue for taste and general sensation. And CN10, our vagus nerve, is a significant player for us for very important activities. Whoops, didn't mean to go past it. It's a mixed nerve that controls the muscles of the pharynx and larynx, conducts sensation from many viscera, and a major source of parasympathetic output. Plays a monstrous role, so to speak, for us. Keep doing the same thing here. Let's try this again. Let's see if we can get a closer look here. So here's our left vagus nerve, CN10, right vagus nerve, CN10 here. And then we have basically from that point, up here our external laryngeal nerve, the internal laryngeal nerve, superior laryngeal nerve, our pharyngeal branch, inferior ganglion, our superior ganglion, all leading up to that. And of course also we have the cardiac branch, the pulmonary plexus. It's playing a role with our lungs and heart to some extent here, because of course parasympathetic output controls plays a great role during times of rest. And this being of course the lung, heart here. And we have our anterior vagal trunk performed from left vagus down to our spleen, our kidney, our liver, pancreas, our stomach, okay? Small intestines, the ascending colon, the appendix. Plays a significant role in a lot of those thoracic and abdominal cavity regions for important organs for parasympathetic output, again during times of rest, not high stress. Motor nerve that controls the muscles of the neck and the pharynx, CN11, the accessory nerve. So here I have our accessory nerve, CN11 here, from the trapezius, going the trapezius muscle, pectoral muscle of the neck here, and the sternocleidomastoid. Okay. Here's the cervical region, the spinal cord, C1 to C5. Medulla oblongata showing here, foramen magnums, you can see where they are, the cranial root, the pons, the spinal root. Here our jugular foramen, our vagus nerve, CN10 playing a role there, and the cranial root diverges and joins the vagus nerve here. And finally we have CN12, the hypoglossal nerve. It's a motor nerve that controls the tongue muscles. And the hypoglossal nerve is here, and branching out here for C1, C2, C3 of the vertebrae, going out here to the tongue muscles, to the geniohyoid muscle, and to the ansa superficialis, infrahyoid, to the infrahyoid muscles. The cervical nerves are running with hypoglossal there. So, what did you learn? What cranial nerves have sensory? Which cranial nerves have sensory functions only would be one way of isolating that, let alone the obvious. You need to know the cranial nerves, where they're located, and their basic innervations on how they're playing their role. And that is section 13 or chapter 13 for brain and cranial nerves.